Hello, everyone. Thank you for joining me today. This is going to be my presentation on the personality disorder case study presentation. I had picked narcissistic, which is a mental condition with an inflated sense of self-importance. Um, it has excessive needs for admiration and attention, lack of empathy, and difficulties in relationships. It is also defined as a long-term pattern with abnormal behavior characteristics. Um, and it's a person who lacks empathy for others, kind of puts their self like kind of arrogant and very self-centered and can be manipulative. Um, they also believe that they are superior. They may also exploit others just to get personal gain. Um, this disorder can significantly impair interpersonal relationships. Um, so now we go to the brief description of narcissistics. Um, Grandiosity, need of adoration, and lack of empathy, like I said. It inflates sense of self-importance. It has fantasies of power, success, or beauty. Difficulty handling criticism, which is everything that we said above. Them feeling superior. They need to seek validation all the time. Um, also can truly impair relationships. Also, for the criteria and the rationale of the DSM-5 for narcissistic, um, um, we refer to as a section of personality disorder. Um, it can have preoccupation with fantasies. Um, they believe they are special. It requires excessive admiration, sense of entitlement, um, explorative behaviors. Also have lack of empathy, envies of others, or believes others are envious, and they have arrogant behaviors. The ICD-10 code for that would be F60.81. Um, so with that, in the DSM-5 TR, it states that in order to be diagnosed with narcissistic um, personality disorder, you would have to have like five um, of the characteristics to be diagnosed. It can reflect long-standing behavior patterns that emerge from early adulthood and persist across various contexts. It emphasizes that an individual must also exhibit distress or impairment in functioning. Um, Then you have the cluster classifications of it, which is a cluster B, dramatic, emotional, and erratic. Other cluster B disorders are like borderline, antisocial, and histrionic. Rational side of it is the emotional instability, impulsiveness, and manipulative behaviors. Um, so this cluster is known for emotional intensity and then impulsivity, and also unstable interpersonal relationships, which goes with that disorder. The individual may also often display overt confidence and have like harbor their deep insecurities. They recognize uh how to um uh they show those traits. So basically, some may be antisocial or have those erotic behaviors. Um also um the next thing is that the cause and risk factors are genetic and biological factors, early childhood environment, excessive praise or criticism, dysfunctional family dynamics. So with that, multiple factors contribute to the narcissistic trait. Genetic predispositions and neurobiological components may play a role also, but early environmental influences such as excessive praise, criticisms, and lack of emotional attunement are especially influential. So the highlight of the role of the development disruptions in shaping a narcissistic defense is to recognize these factors and, go ahead and aid in the early intervention and risk reduction for um, the narcissism. Then we go on to the course of treatment. So there are several different therapeutic approaches. Here it shows the psychodynamic therapy, cognitive behavior therapy, um, also being able to focus on improving interpersonal skills, managing self-esteem and expectations, developing an empathy. Also, narcissism can be with like a co-occurring condition such as depression and anxiety. So, um, I always think about, the cognitive behavior therapy, which, if you can change the mind, you can change the behavior. Um, it also helps with, individuals exploring unconscious conflicts or relational patterns. It may just be like, helping them find the maladaptive thoughts of the behavior. Also, a key goal when it comes to empathy and improving emotional regulation is to really get them to understand or find who they really are. Um, and also get down to like the co-occurring disorders that you may need medication for, such as depression or anxiety. Then we go to challenges that may come into the treatment, which is like resistance to acknowledging problems. So, being in denial, difficulty forming therapeutic alliances, high dropout rates, need for long-term commitment. So, with that being in denial, of course, you're going to be resistant and not wanting to really, take that responsibility or being accountability. Um, and it's hard to trust people, especially if you already feel like, you're superior. So um the unique challenges in therapy may be that the clients um may need to just figure out self-image, working on that self-imaging, being able to change the mind, to change the behavior. Also, trying to gain the client's trust and being able to engage and, trying to find what works for them based off of who they are and, what they believe. Also, helping them with progressing and building on the character of who they really are and um showing them that there's other ways to be able um, to overcome treatment resistance. The next thing is prognosis, which is varies of individuals. Prognosis is better with insight and willingness to change, stable relationships and support. So having that good support and being able, like I said, if we can change the mind, we can change the behavior, and they'll be able to have that insight on who they are and be willing to make the change. The high dropout rate in therapy because of not being able to gain trust or, not able to really feel like they belong. So with that being said is, being able to keep them motivated, taking care of the co-occurring conditions, and also helping them find that self-awareness and willingness to change in therapy by getting to know them and gaining that relationship. Um, Also, maybe being more structured for them so that they are able to be consistent. Um, so that they can see like promising results when it comes to the prognosis. Next is the prevalence of the general age population, which is the 0.5% to 5%. This is mostly common in males. Often occurs with disorders such as depression, substance use, and other personality disorders. Um, it looks like it frequently occurs with mood, anxiety, and other personality disorders, complicating diagnosis of treatment. So sometimes, it's a more higher rate when it comes to interpersonal dysfunction. Also, wanting to understand and inform public health strategies and able to help those that may see this in somebody that they know or loved. And yes, that is it for my presentation.